Good evening. It is a pleasure to open our fifth ischemic conditioning event. This has been a great 5 years. Since 2009, the first meeting in EHA 2009 with Dr. Kloner and a number of other leading researchers till now. Last year we had a combo event which triggered quite a few ideas, new ideas, and generated some interest beyond ischemic conditioning. I'll touch on those towards the end. Today, as you can see in front of you, the agenda, we have a number of topics to cover. The first speaker is the leader of the field by all accounts, Dr. Kloner, who's brainchild of remote ischemic conditioning, has gone far beyond his laboratories and is turning to hopefully a life-saving treatment for many patients. And he will give you a broad view, somewhat perhaps a reminder of what we have learned so far. I would like to just summarize everything that I have in my mind in this slide, that ischemic conditioning, preconditioning, conditioning, post-conditioning, collectively I call them ischemic conditioning, is truly revolutionary. You call it disruptive, or you can call it amazing concept that badly needs to come to patient care, to wellness, to even athletic and performance or endurance enhancement, and we have science for all of these. So without further ado, as you know, dinner is going to be served, so we will have both lectures and dinner served at the same time. Most of these presentations over years been viewed online in the order of hundreds, if not thousands, more than the attendees in this room. But we purposely set the presentation and the meeting in a form of a focus group meeting because we would like to invite discussions, brainstorming thoughts that you would like to discuss further. But our speakers come with a rich deck of slides, and they will be sharing with you their findings, so quite a few original findings, and then we will engage into interactive discussions. I'd like to thank Endothelics as a sponsor of this event. Will Sotka, Vice President of Sale, is here to provide insight on behalf of Endothelics. Is a company that provides endothelial dysfunction monitoring device. Fits very nicely with ischemic conditioning. In fact, we have several papers at AHA this year showing the interrelationship between endothelial function and ischemic conditioning. Also, IC Therapeutics, which is the organizer of this event, Dr. Yin, my colleague, is behind us. So without further ado, I'd like to give you Dr. Kloner, the Chief Scientist Officer and Director of Ischemic Conditioning Therapeutic. Dr. Kloner.
Thank you very much, Mort, and thank you all for coming tonight. So we have, I think, an exciting program tonight. The focus tonight really is going to be on clinical aspects of conditioning. Ischemic conditioning has been shown to be really a powerful cardioprotective approach. Ischemic preconditioning was first shown by Chuck Murray and Reimer and Jennings back in the 80s. And they showed in a canine model that brief episodes of coronary occlusion prior to a longer coronary occlusion could markedly reduce the size of myocardial infarction. Work by Hirschklink and Birnbaum and others have shown that you can reduce infarct size by inducing ischemia of other beds, other vascular beds. So we know that brief coronary occlusions in an opposite coronary bed will protect the myocardium from infarction. We know that inducing brief episodes of ischemia in the limbs can reduce myocardial infarct size in both preclinical studies and, as you're going to hear, in clinical studies. So these observations in the laboratory have now been translated to many clinical trials looking at not only myocardial infarction, but as you're going to hear tonight, heart failure, stroke, traumatic brain injury, athletic performance, and a host of other targets. And I think most in this room know that brief episodes of ischemia, either in the ischemic territory or the remote bed from the ischemic territory, can be protective. In the past at these meetings, we've focused on certain aspects of basic science, the mechanism of conditioning, but tonight we are really going to get right into clinical applications and clinical studies. We have three fine speakers. We have Dr. Professor Nilesh J. Samani, who's going to discuss remote ischemic conditioning and post-myocardial infarction heart failure. Dr. Hans-Erik Bottger, who was really one of the first to show that remote conditioning in patients could reduce myocardial infarct size. He's going to discuss for us tonight another aspect of this, and that's neuroprotection. Dr. Hiro Tanaka, who's going to actually discuss athletic performance. And I think while listening to these clinical studies, we'd like your comments, we'd like your discussion, we'd like your suggestions. There's really a need for larger studies to be done here in the United States, perhaps in a consortium format, including industry, practicing physicians, scientists, and government agencies such as the NIH. Today, there have been very few large clinical trials done in the U.S. in this fashion, sponsored by numerous agencies, including government agencies. We hope that that will turn around, because this is a very cost-effective way of treating patients. It's very inexpensive to go in with one of these devices and induce brief periods of ischemia and reperfusion in the limbs or the skeletal muscle. And it's something that we ought to be thinking about when we think about things like cost effectiveness. So with that, I want to introduce Dr. Nilesh Samani. He's British Heart Foundation Professor of Cardiology, Head of the Department of Cardiovascular Sciences, Director of the Leicester NIHR Biomedical Research Unit and Cardiovascular Disease. He's going to talk about the DREAM study, daily remote ischemic conditioning, and post-myocardial infarction heart failure.